Yeah, good afternoon to everybody who's joining now. We're just giving it 1 to 2 minutes until more participants are here, and then we'll start. Okay, I suggest that we start so that we don't run over by too much later on. So welcome everybody to this third seminar that is jointly facilitated by AKADEMIYA2063 and the University of Pretoria. We're very delighted to have you with us today. My name is Katrin Glatze. I'm Director of Policy Innovation at AKADEMIYA2063, and I'm based in Dakar in Senegal. We have an exciting session ahead of us with 3 presentations of ATOR. So that's the Annual Trends and Outlook Report 2021 report, with 3 speakers from IFPRI, FAO, and AKADEMIYA2063, and 3 discussants, students, master students, and PhD students from the University of Pretoria. So it's going to be a session packed full of content, and we look forward to the interaction with you at the end. So each presentation will last about 10 minutes, and we've asked discussants to prepare about 7 minutes of feedback, comments, questions, and suggestions for future research, perhaps also additional input on the methodologies that have been used. At the end, so after the 3rd presentation, we have a Q&A session that is open for everybody then to come in. So I would really like to invite you to note down your questions, put them in the chat throughout the session, and if you feel very courageous, raise your hand at the end and you can directly interact with the speakers. I will introduce the speakers as they come. And lastly, before I hand over to Cheryl, the meeting is being recorded. It's also live streamed on YouTube, and the link to the recording will be made available to you afterwards. With that, over to you, Cheryl. Cheryl, are you still with us? It seems she may have dropped off. I think she said that there are power cuts going on. In that case, perhaps we'll jump straight into the first presentation, and then we can give Cheryl the opportunity to say a few words when she's back online after the first presentation. Cheryl, I see you're back. Cheryl, are you ready to make short introductory statements? Okay.
Can you hear me?
Then now we can hear you. Yeah. Okay, so I think the connection is a bit shaky at the moment, Cheryl. So we will go ahead with the first presentation, which is by my colleague Getaw Tadesse. He will present chapter 6 of the ATOR report on assessing African economic policy responses for COVID-19. Getaw is the Director of Operational Support at AKADEMIYA2063. He holds a PhD in agricultural economics from the Norwegian University of Life Sciences. And before joining academia, he worked as a research fellow for many years at the International Food Policy Research Institute in Addis Ababa. And he was also previously for the Center for Development Research at the University of Bonn in Germany. In Getaw's research, he seeks to understand the dynamics of food prices and trade at local, national, regional, and global markets, the role of private sector and civil society in African agri-food systems, and the impacts of policies and programs on food and nutrition security. We have a commentator for this presentation, which is Mr. Lokangeli Mgeba from South Africa. He is in his final year of master's degree at the University of Pretoria, studying rural development. And in his work, he's focusing on policy options to transform food systems towards affordable, healthy diets. So Getaw, I'd like to invite you to make your presentation.
Yeah, I want, thank you, Catherine. Julie, can you unshare? Because I couldn't share, yeah. Yes. Can you see my screen?
Yes, we can.
Yeah. Okay. Thank you, Catherine, for your introduction. I'm glad to present my chapter on ATOR 2021, which is about COVID-19, entitled Assessing African Policy Responses to COVID-19. We co-authored with my colleague, Wendo Santafara. He's also staff of AKADEMIYA2063. So I will briefly present the content, the methodologies of this, and then the conclusions. To start with, I think, as you know, many African countries have adopted several policies and programs to protect households, business, and economies from the adverse effects of COVID-19. And I think those policies are ranging from macro policies to micro policies and different types of regulatories and also supportive type of policies, and a lot of a wide range of policies have been made in African countries. And several institutions, including the Oxford University, IFRI, and all other institutions, they have tried to track the policy responses, the events, and all those things. However, they focus on the tracking incidence intensity of policy response, and also they mainly focus on macro level responses. Only few studies have assessed the effectiveness and the impact of the policy responses. And as we know, this the response for COVID-19 is a social protection intervention. Then I think the effectiveness and the impact is highly important. So this paper tries to, I think, qualitatively evaluate the effectiveness of COVID-19 policy process. We focus on the process aspect rather than on the outcomes at sectoral levels, and to identify areas where African countries are making success and some weaknesses. And also we aim to identify drivers of success in planning and implementing emergency responses. And by doing that, and we just try to look at the importance of policy process for impact and also identify best practices. So these are just two objectives. We want to evaluate the effectiveness and just identify some of the best practices that some countries have developed based on a sample of 17 countries from Africa. So basically, the study is just a process evaluation. You know, for impact evaluation, we have three types of impact evaluations. So the performance tracking, which is mainly about the M&E, the tracking progress and achievement against set targets. And the second one is the process evaluation, which explores the effectiveness of the policy program process towards achieving its goals. As you know, a program or policy has a different stage process, from planning to implementation to impact evaluation, all those things. But this one is a process evaluation that usually commonly we do in the middle of the program implementation. And the impact evaluation, I think many of you know how to do conduct. But for this study, we focus on the process evaluation aspects, and we measure effectiveness and all these things based on qualitative approach. So basically, we use two types of process effectiveness indicators. The first one is a planning effectiveness, which we call it responsiveness. And this we defined based on the type and number of policy options that the sample countries have implemented. Basically, we divided them into regulation and promotional policies, which are just direct supports and all these things. But the regulatory policies are just like rules and all those things. And their effectiveness on outcomes are different. So we just give them different scores for those. And also the speed of response relative to COVID-19 outbreaks. And I think who has responded very soon, and then relative to the emergence of COVID-19 in Africa, as you know, just January was the first case that have been reported, and then we start to look at those things, how countries are responding in terms of absolute number of timing. And implementation effectiveness, we just measure in terms of timeliness of implementation, not on the adopting of the policies, but also in terms of implementation of the programs relative to containment for food responses and relative to planting times for input policy responses. And we also looked at targeting of beneficiaries and commodities, how countries have, did something on targeting beneficiaries and also commodities, because some commodities are good for the poor and some others are not very much important. And also more important is the innovativeness of methods of implementation, because how they have been implemented in terms of delivering the supports to the beneficiaries and also monitoring the progress and all these things. So I think we just use these two indicators and we measure them qualitatively using a mixed method approach. As you know, mixed method approach is just a qualitative way of doing things, but with a little bit of some quantitative issues. So the two indicators were just scored based on the response from 17 countries. What we did is we just developed a questionnaire about the policy response and everything, and we submit for the countries, in the countries where we have some experts who knows better about the different policies and all these things, and we got a response from some. Actually, we sent the questionnaire for many countries, but we got only from 17 countries. And then we estimated these two scores, the effectiveness score and the policy response scores. So the result, just to briefly show you that this is the responsiveness score that we developed based on the type and number of policies responses, and also the speed of the responses for the 17 countries, and for the different sectors, for food sector, for seed, fertilizer, and trades. And if you look at them, I think some of the countries are performing better than the others in terms of that score. So generally, only 3 countries didn't respond in food sector. That means almost all the countries, most of the countries, they have responded in terms of food transfers and all these things. And 8 countries responded in all the sectors. I mean, in terms of food, seed, fertilizers, and trade sectors, all of them, they have responded, but I think the scores differs from country to countries. And some of you, for example, if you look at the blue one is for the effectiveness, I mean, the responses to food, and the red one, a little bit red one was for seed responses. So some countries may have responded, for example, Lesotho has responded only for fertilizer and seeds, but the others, they responded for all the sectors. For example, the Burkina Faso, Ghana, and all this Lesotho and Kenya, they responded, but their response is different from sectors to sectors. So in terms of implementations, implementation effectiveness, we have seen that some countries perform over the others, and only 6 countries have an average score of more than 70%. That means, the one who was very perfect or good, we consider as 100%, but only 6 countries have scored 70%. That means many countries are lagging in terms of targeting, in terms of timeliness, in terms of innovativeness, and all these things. And the input policy response implemented better than the others, because I think countries, we realize that countries are better more effective in implementing input policies than food and trade policies. So those are the findings that we found. But generally, what we see from here, this is the highest, the percentage of countries with the highest score, for the different sectors and for the different criteria that we use to evaluate effectiveness. If you look at all these things, the food policy, which is represented by the blue graph, response seems sequentially and timely planned and targeted. Input policies response implemented innovatively in a sense, they have used some digital platforms to deliver those transfers and also regulations, and also they use some vouchers. For example, the input delivery vouchers in some countries like Kenya and all these things. And food and trade policies response are implemented very lately and less innovatively implemented. So that means that it's not only the effectiveness, not only varies across sectors, but also it varies depending on the different criteria and different criteria of effectiveness. That means some countries are performing in targeting and some are not performing well in innovativeness and all these things. So those are the things that we observe from our data analysis. And then I think we just looked at the importance of process effectiveness. Just looked at because one of our in our department, in our institution, I think the food price analysis team, they were doing the impact that I think last time we presented that the impact of COVID-19 on food prices. And then what we looked at the impact of COVID-19 on food prices across the different effectiveness scores. For example, these are the SAPR is the responsiveness score and the PIP is the effectiveness score. So if you just look at the scores, the process, the effectiveness scores and the impact of COVID, and you will see that significantly the one who has the lowest responsiveness score has the highest impact of COVID on prices. So generally it shows that the process effectiveness is very critical in terms of, protecting markets and protecting households and all these things. For this specific case, for the food prices, I think responsiveness score is more important than the implementation score. Maybe the implementation score might be more important, for example, for welfare impact or other things. And that's what we see in our chapters. And then I think we try to identify also the best practice data in the implementation of the responses. I think what we do is we just identify the top effective countries based on the principal component analysis and of the different factors that we consider in our data, and then characterize the top performing countries to identify best practices. And these are the results for the different practices and the percentage of the countries who are implementing, these practices from out of the top performing countries. And based on this table that we identified as best practice varies across sectors, that's definitely the case. And generally, the use of multiple instruments, that means both supports and regulations, and also market-based responses. That means just like market, depending on the market reactions, and also the use of task forces, because many of the countries, they have used task forces to implement the responses. These are some of the best practices that lead to effective implementation. So that is what we realized from our qualitative analysis. I think these are the different things that we looked at in the study. And generally, I think maybe those who are interested on the chapter, you may refer that one. But generally, our conclusion is that from policy perspective, there is a strong need to improve policy response at planning and the implementation stage, especially for social protection programs. They are very sensitive for so many disincentive effects and all these things. So even the planning stage, for example, in terms of identifying the right instrument, policy instrument, this is very critical. And we realize that the use of multiple instruments, as usually the case for social protection, is very important. The use of innovative application like digital platforms for delivering services and transfers and also monitoring activities is very critical. In terms of research, I think we need a more rigorous analysis of the impact of those policies and their long-term impacts in terms of different outcomes, both at household and community levels. So those are the implications that we draw from our simple and qualitative analysis based on the sample studies we get it from there. So I think with this, I have to stop here and over to you, Catherine.
Yeah, super. Thank you very much, Getaw. I won't say too much, so I'll hand straight over to Lukangele for his remarks and comments.
Thank you, Dr. Catherine. Good afternoon to the panel and to the attendees. I hope I'm audible.
Yeah.
Yes, we can hear you.
Okay, thank you. I'm grateful to be one of the discussants today, and also thank you to Dr. Getaw for the insightful presentation. Well, as far as assessing the African economic policy responses to COVID-19, I think one has to appreciate the robust responses by African countries to the complex economic problems brought by the COVID-19 pandemic, especially when considering the difficulties that many economies were facing prior to COVID-19, such as food insecurity and poor healthcare, among other problems. It is really remarkable to see smaller economies in the continent outperforming big economic players like South Africa and Egypt as far as their average economic support is concerned. Therefore, I think many African countries which had lower responses to COVID, especially those with the financial means, they have a lot to learn from countries like Burkina Faso that responded in all 4 sectors, so that as a continent, we can leverage on the unique factors that enabled these small countries to respond better to COVID-19, to respond better and effectively to the COVID-19. Furthermore, I think we also need to think about some of the policy actions that we can retain after the pandemic, such as increasing social protection coverage or maintaining the social grants that were handed out during the pandemic. As much as COVID-19 has exposed global inequalities, it has also offered an opportunity for the African continent to reinvent itself. This includes revisiting our African Union commitments of at least investing 1% of the GDP in research and development, and extending this to healthcare, as we fell behind in terms of accessing the vaccines, which delayed our economic growth because there were a lot of activities that we could not engage in because we had low vaccination rates, especially the tourism sector, which was mostly affected in many African countries. I also think now the broader question to Dr. Getaw is how do we modify our economic responses to address now the cost of the pandemic, considering the debts that we incurred, especially in loans from the development banks, and as well as how do we prepare for the next pandemic, because it's imperative that as a continent, we aim to reduce the dependency on European and Western countries, and we also need to adjust to the current conflict in Ukraine and Russia, which is driving up the cost of food. And as far as the economic measures, the health and the economic measures, I would also like to know in this analysis, I think I would have loved to see other health measures mentioned explicitly. For example, in South Africa, the government had to bring in healthcare workers from Cuba. These are people that were deemed as experts and who had the knowledge on how to address this pandemic. And we also saw we had a shortage of hospital equipment such as respirators. The governments, they also had to make that expenditure. So I'm curious as to how would these measures have been treated in the study, considering, according to my opinion, that they are neither containment or sanitary. Thank you.
Thank you very much. Getaw, we have a few minutes for you to respond before we move to the next presentation. Over to you.
Thank you. Thank you, Catherine. I think, thank you for your comments and also for your questions. I think, how do you modify the question? How do the African countries modify their responses, social protection responses? I think one thing, as you said, I mean, many African countries are responding this time for different crises. One of the biggest challenge in social protection is our response should be dependent on the type of risk that we are facing. For example, the risk we faced for COVID-19 is different from the case for the one we are currently facing because of the war between Russia and Ukraine. So I think they need a different way of approach and a different way of responding. For example, for the COVID type of response, which also restricts the movement of people and the movement of all these things, and probably African countries must focus on establishing their capacities in terms of this virtual and digital way of, delivering services and also communication and all these things. So I think those are the things. And I think if PRI has assessed the different networks, these digital platforms that are being implemented, and that may help for countries to respond for this type of risks. Because those are the things that African countries need to focus. And the other one, maybe for the other type of responses, then maybe the usual type of response might help, but it depends on their capacities in terms of finance and all these things. And the other one is on how would you prepare for it. The next one, I think probably, some of the African countries, even if the small countries are performing very well, but still social protection requires some sort of economies of scale. So probably regional response like the one we have started in West Africa, for example, the food grain reserve, the food reserve, regional food reserve. That might be one way to prepare for the next. Risk is always there. We live with them. Whatever, it can be global, or it can be regional, or it can be local. So I think that way, that type of response or preparedness might be more important. In terms of our methodological things, I think I'm sure that this is only for few cases and a few countries. And there are social protection is very, very diverse in terms of instruments and all these things. So I think more comprehensive studies are required to include all those health supports, economic supports, social supports, and also from producer perspective, there are also some subsidies and all those things that can be broadly considered as social protection. So I think those are the comments I can deliver. Thank you. Back to you, Catherine.
Great. Thank you so much, Getaw, and thank you also to Lukengele for those very good comments. Thank you both. With that, let's move to the second presentation. We will try to bring Cheryl in at the end for some closing remarks. Hopefully the internet has stabilized by then. So I'm delighted to introduce our second speaker, who will present Chapter 7 of the ATOR report, which was on delivery of social protection programs to combat COVID-19 in Africa. Jan Duchoslav is a research fellow with IFPRI based in Malawi, where his work on issues of resilience and social protection borrows from development, behavioral, and agricultural economics. He is fascinated by people's diverse responses to incentives and studies how shocks to the physical and social environment affect their preferences and behavior. Jan is driven by a desire to see his adoptive country, which is Malawi, I assume, thrive, and uses insights from applied microeconomic research to help shape effective policies. Welcome, Jan. Before I hand over to you, I'd also like to introduce the commentator of the second presentation, which is Mahalatsi Makola. She's a master's candidate at the University of Pretoria under the Agriculture Rural Development Program. And she's currently completing a research study on the risk assessment of transboundary animal diseases on food systems. So welcome both, and thank you very much for being here today. With that, over to you, Jan.
Thank you, Catherine, and thanks everybody for making the time to listen. I should start by apologizing. So despite all this talk of COVID-19, I was surprised to find out that the flu still exists. So if my voice is a bit funny, well, that is why. In any case, I will talk about so Getaw spoke more generally about general policy response to COVID-19 in Africa. I will zoom in a little more on the delivery of social protection programs and how they address the COVID-19 pandemic and the problems stemming from it. This work was done together with my colleague Kalle Hirvonen, who's also at IFPRI. He started this in Addis Ababa and now moved to Helsinki, in fact. But let's get into it. If I manage to move yes, move my slides. Yes, I do. I can. Social protection, just as it has been for quite a while elsewhere, social protection has become a common policy to address poverty and food insecurity in Africa, especially over the past 2 decades or so. There has been there really has been an increase in the uptake of social protection tools by African governments, to the extent that now pretty much every single country on the continent has at least one social protection program running. However, in the past, it has focused mostly on rural areas where, of course, most of the chronically poor tend to live. The problem with that, when it comes to COVID-19, is that COVID-19, and especially the measures that many governments adopted to fight it, have disproportionately affected the service and industrial sectors, which tend to be located in urban areas. So there's a bit of a disconnect there, which often makes existing social protection programs ill-suited to respond to COVID-19. And that means that in order to use their social protection programs to respond, many governments had to either adjust the existing ones or put completely new ones in place. Now, these have, especially the existing ones, have mostly been designed to protect against chronic poverty and income shocks, which is sort of the standard way social protection programs tend to work. But the pandemic affects many more aspects of life. It has affected health, of course, people's incomes. It has affected food systems, logistics. People could not move around as much as they would like. So that the big question there is social protection still effective when facing such a multifaceted shock, even though most social protection programs were designed to fight very specific shocks in a way. There is so far some fairly limited but encouraging evidence that social protection can actually be effective against these multifaceted shocks like a pandemic. There are a few studies from Kenya, one showing that universal basic income has increased both food security and health of the beneficiaries. And there's also evidence also from Kenya that cash transfers have improved micro enterprise performance and help prevent them from closure during the early stages of the pandemic. From Ethiopia, we know that the productive social safety net program, with which many of you I think will be familiar, has actually helped to improve food security in the face of the pandemic. And from elsewhere, these studies are from Latin America, I believe, Colombia and Venezuela. Colombia and Bolivia it is. We see that cash transfers have improved food security and that they have reduced asset depletion when people are faced with COVID-19 related shocks. So there is some growing evidence. More still needs to be done probably to really assess the effectiveness of social protection, but it has some it does have some beneficial effects when facing such complex emergencies. So having said this, what we then did in our work was to zoom on 3 specific countries in Africa to see how the existing or new social protection programs actually targeted the people that they were meant to help. We look at 3 countries: Ethiopia, Nigeria, and Malawi. So what you can see here are graphs that show how essentially any social protection in on the left-hand side Ethiopia and on the right-hand side Nigeria were targeted on people of different wealth. So in each of the boxes, you have households from the poorest ones on the left to the richest ones on the right. And then each of those boxes is split for rural areas on the left, urban ones on the right. And what we can see in Ethiopia is that, oh yes, and I should say that these numbers come from phone surveys that were conducted by the World Bank on the same on a subsample of the households that were interviewed for the LSMS surveys, with which many of you also, I think, will be familiar. What you can see for Ethiopia on the left-hand side is that social protection programs in general, as well as the flagship PSNP, were fairly progressive in how they were targeted, meaning that the poorer households were much more likely to receive assistance than the wealthier ones, than the richer ones. Throughout this was throughout the first year of the pandemic. So in some sense, in Ethiopia, the social safety nets responded to those who presumably were the most vulnerable and most likely to be affected by by insecurity, by food insecurity and poverty in general. In Nigeria, on the right-hand side, the picture is very different. In urban areas, there is pretty much no difference between the richer and poorer households in terms of receiving benefiting from social protection, so social safety nets. In rural areas, if anything, the programs taken together were actually regressive. So the richer households were more likely to benefit from them than the poorer ones. So what you can see from this is that there are very different pictures of how well different social protection programs are targeted in different places. And obviously, some places there still is a huge space for improvement. In Malawi, which is obviously the country that I'm more familiar with, the picture was somewhere in between. By far not as progressive as in Ethiopia, but not as bad as in Nigeria. But what I'll use this example is to look at more the process of how some of these responses actually took place. So what you can see on this graph, the blue line are the numbers of new confirmed cases in the country. So you see that in the first year of the pandemic, so you see, well, the first wave there between May and August 2020, and then the second wave starting in late December 2020 and going into 2021. And the government adopted various measures. The red ones are essentially those that would be likely to have a negative effect on people's livelihoods, whether it be limits on movement, whether it be closures of schools, etc. The green ones then are those that you would expect to actually lessen the burden of these measures on people's livelihoods. And if you zoom on this almost last one, in in February 2021, you see that there was an introduction of a new urban cash transfer program intended to, help the most affected poor people in urban areas who previously were not reached by existing social safety nets. And this looks like a very quick response to that second COVID wave. On the surface, of course, then if you look a little bit more in depth, what you realize is that this program was actually announced even before COVID arrived officially to Malawi. It was meant to protect the urban poor from the very get-go. It got funded finally after the first wave subsided, and then still implementation took so long that it actually was put in place almost at the height of the second wave, almost by accident, rather than by design, which shows that implementation of many of these programs still is an issue, and there is quite a bit of space for improvement there. So to briefly conclude this, before I say a word or two about the methodology which we were asked to do, social assistance certainly is effective at improving food security and protecting assets. This has been well documented in the past, and there is emerging, even though still thin, evidence of its effectiveness during more complex shocks such as a global pandemic. We have seen both existing and new social protection programs used to counter the effects of the pandemic, but there is certainly room for improvement. One, in terms of coverage to begin with, because still many existing programs target essentially the wrong population, the rural poor, whereas these new shocks often affect more the urban poor. There's certainly room for improvement in terms of targeting. You saw that some countries do much worse than others in terms of targeting those that need help the most. And as shown by this example of Malawi, there's implementation also is lacking. One thing is having the right policies in place, another is implementing them effectively. Now, if I were to summarize this in one word in terms of what is needed, it would really be flexibility in the programs, in terms of expanding both the base, both the people that they are targeting, as well as the amounts that social protection provides to people in response to crises that come and go, such as the multiple waves of the COVID pandemic, or even now, again, this has been mentioned, the ongoing crisis in Eastern Europe, where which is driving food prices up across the world, including on this continent, of course. Now, for those who have who might have read the chapter, you will have noticed that it is a quick, sort of synthetic and descriptive study. The first part makes use essentially of a literature review. The second part shows a few correlations. So this is certainly nothing that would put numbers on the effectiveness of social protection to face crises like the COVID-19 pandemic, or on things like the cost-benefit analysis or any quantification of the effectiveness. This is something that certainly is left for further research, and different methodologies will be needed for that, and also much more time. I think time is something that I've certainly run out of. My apologies for that. I'll pass it on to the discussant. Thank you.
Thank you very much, Jan. And I like your key takeaway on the need for flexibility and agility in program and policy design in response to crisis. Yeah, really important. Thank you. With that, I'll hand over to Mahalatsi for her comments and questions.
Good afternoon, everyone on the platform. Thank you for the opportunity to speak. I just have 2 pointers that I picked up from reading the chapter. And I think one of them is in line with what Dr. Getaw spoke about, the difference between emergency response and a social protection program. So from observing the 3 case studies, it was shown that traditional social protection programs were adapted to suit the pandemic and what kind of assistance the household would need during the uncertain times. So many of the social protection, they still remained to fall short, unfortunately, even after targeting the most vulnerable households, mainly because of funding, as I realized. But my question is because COVID was a shock to everyone, and how much planning can we do in terms of social protection? Is it not more reliant on our readiness and emergency programs that can help instead of reacting too quickly and putting our social protection programs at the forefront, and rather rely on readiness programs to help with the upliftment of the impact of the pandemic? I don't know if you want to answer the question first, or I should go with my second question as well.
Maybe go ahead with the second one.
Okay, and then my second observation was made in reference to Ethiopia's target accuracy compared to Malawi and Nigeria. So it seems that when push came to shove, Ethiopia prioritized the most vulnerable of the poor, which was the poorest rural households. And even though it was only for 2 months or so, but they still managed to prioritize the poorest, and they managed to have a progressive target accuracy. So there's the case study of Ethiopia revealed to us that in times of crisis and where a lot of people will be needing assistance, we must accept that there will be definitely winners and losers, if I can say, and therefore we should rather focus on the matter of prioritizing the poorest instead of I guess this is what has to do with the emergency readiness. Instead of trying to cover everyone with the social protection programs, so should we rather prioritize the poorest? And in the sense that we need to prioritize the poorest, because I believe that they are the ones that are most affected by a pandemic as such, and their impact on the economy will be more severe compared to those that are not in the same position as them. Thank you.
All right, Catherine, do I have time to respond?
Yes, please go ahead.
All right, so thank you, Mahalatsi, for the comments and questions. I'll take them in reverse order if that's okay. You know, should social protection programs be focusing on the you know, most vulnerable ones or the poorest ones, or you know, in cases of emergency, just should everybody be helped? If that is that's how I understood the question, and I think the answer really depends on what on the capacity of those who are implementing these programs to actually do the targeting that is necessary, and on weighing this against the resources that are available, right? I think it can be thought about in many ways as a type 1 versus a type 2 error. Do we you know, just want to go out and help everybody, or can we actually distinguish between those who need help more than others? And that I think is extremely dependent on each of those each of those programs specifically, right, and on their capacity to make this distinction. Obviously, in Ethiopia, the PSNP has been in place for a long time, and perhaps the country has more experience with targeting with limited information and limited resources. There it can be done. Elsewhere, you might end up spending more resources and more time identifying the most needy ones than you would spend if you just help everybody. But I think in general, this is something that needs to be decided case by case. And I think that brings me to the first question: Are social protection programs well suited to respond to crises rather than to sort of more chronic poverty and insecurity? And that again depends probably on how how flexible they are. Obviously, not all are suited. I think we saw that from what we wrote in the chapter. On the other hand, often they are one of the few tools available, and if they can be made flexible, such as seems to be the case in Ethiopia, then they can be a suitable tool for the job.
Okay. Thank you very much for those responses, and again, thank you so much to both of you, for Jan for the presentation and Malawi for those comments. And that now brings us to our third and final presentation on rethinking the role of social protection in African food systems post-COVID-19. Our third speaker is Nicholas Sitko. Welcome, Nicholas. He's a senior economist in the Inclusive Rural Transformation and Gender Equality Division with FAO. He was previously Assistant Professor of International Development at Michigan State University and based in Zambia for project. He has published in the fields of climate change adaptation, social protection, technology adoption, land administration, and market development, with a particular focus on small-scale producers. He holds a PhD in human geography from the University of Colorado and is motivated by a desire to foster a more just and equitable world through better targeted and designed policies and programs. So very topical research areas, Nicholas, and very much look forward to your presentation. The commentator for this third presentation is Yetunde Olugbade, who is a PhD student at the University of Pretoria, and her current research area is on the transformations that are peculiar to the food systems and how they have evolved over time. Her general interests include agribusiness and underutilized indigenous crops. So without much further ado, Nicholas, over to you.
All right, thank you, Catherine, and good afternoon, everyone. Very happy to be here. Excuse me, I'm also suffering from a bit of a cough, so excuse me. So, I hope this presentation, this has been a really good discussion, and I think this presentation of mine kind of fits in with some of these discussions about how we can think about leveraging food systems to achieve kind of multiple objectives, not just single objectives, and what that means in the context of COVID and kind of general global uncertainty, which I think is how we can characterize the current age. So this I'm presenting on behalf of various co-authors who are listed here. So let me just begin with the big message, right? And so the big message is COVID-19 and efforts to contain its spread exacerbated what are long-standing challenges faced by African food systems and exposed, or further exposed, let's say, many of the associated livelihood vulnerabilities that people who depend on these food systems face. The paper itself, really, like everybody else here, we were responding to an immediate context. So this is not based on a deep dive, deep analytical dive into evidence, because evidence was thin or fairly non-existent at the time of writing this. It still is pretty thin, frankly. So we pulled from some descriptive evidence on social protection responses, coverage that's compiled by colleagues at the World Bank. But then we try to kind of make sense of these data and this information with our understanding of the literature and with a conceptual framing around kind of food system vulnerabilities and livelihood vulnerabilities within food systems. So kind of the big messages, and these I think are fairly consistent with other colleagues, but so the social protection response in sub-Saharan Africa, it was in some ways quite impressive. A lot of countries rolled out new programs, and we'll get to that, but really kind of insufficient to the magnitude of the challenge, both in terms of coverage, duration of coverage, et cetera. So insufficient to stem widespread livelihood losses throughout the food system. And so somewhat contrary, not contrary to Jan's point, so I appreciate the fact that, excuse me again, the restrictions were really concentrated in urban areas, and urban people faced real livelihood challenges. Rural areas are very much enmeshed with these urban areas. And so what happens in urban areas kind of ripple through rural economies and so do have very kind of widespread impacts on rural livelihoods as well. And I think that's important to take into consideration. So that's point number one. Point number two is that we need to strengthen and actually begin to reconceptualize and redesign our social protection systems. And so this gets to our point about, emergency response versus, what is a social protection program? And I'm going to advocate for kind of a reconceptualization of what social protection is. Both in terms of post-pandemic recovery, but also kind of more broadly in this era of global economic uncertainty. So we are almost certainly in a world that's going to exceed 1.5 degrees Celsius increase over pre-industrial age, and probably 2 degrees. That means we're going to hit biological tipping points on all sorts of things, and social tipping points. That's certain. Political instability, price instability, all these things. So we need to kind of think about what role social protection has to play in this world. And we need to think about how we can leverage social protection, not only to kind of respond to immediate welfare impacts, but also to support the building back of food systems, the recovery, and fostering more widespread resilience. So, so let's think about food systems in sub-Saharan Africa. And so in the paper, we sort of think about 4 kind of, let's say, functional nodes in the food system and what characterizes them. So we have farm laborers, we have primary producers, we have intermediaries who serve various roles on the input and output side, and then of course we have consumers. What I think, kind of the thing that sort of cuts across all of these functional elements of the food system is that we have a high concentration of or a kind of high prevalence of informality. So that means we have people who do not have access to kind of formal social safety nets, wage insurance, unemployment insurance, credit, all of these kind of things that come with more formal systems. We have very small scale operations. So these are not people that can draw from large kind of stocks of liquidity to solve problems. These are people that are cash flowing their operations every day, right? And we have a very high degree of mobility within the food systems, right? So we do not have in most African food systems contracting where you can sort of sight unseen trade in futures contracts, for example. We have people that are producing small lots for market, that's being aggregated by small-scale producers, it's being brought to market, it's being traded in small quantities in open retail markets, et cetera. So these are livelihoods that are very sensitive to mobility restrictions in various ways, from accessing necessary inputs to accessing markets, et cetera. So COVID-19 obviously had, and efforts to contain its spread had a very profound effect on people's ability to carry out these kind of activities, right? Even if they were meant to be exempted from restrictions, and in most cases they weren't, and informal markets being closed, et cetera. So lots of vulnerability. So then where does social protection fit in, and how can we kind of think about the role of social protection in this case? So a lot of what we've been talking about already is in terms of, so social protection can play multiple roles, right? And so just to kind of define what we're talking about when we talk about social protection, there's multiple kind of dimensions to this. So there is social assistance or social safety nets. So these can be, these are your kind of cash transfers and food transfers and public works programs, et cetera. There is social insurance. So this can be like social security programs or wage insurance or unemployment insurance, et cetera. And then there is like labor market interventions, so wage subsidies and things like this. And we often think about these as serving kind of immediate protective and preventative roles, right? So meant to protect people's consumption from, falling below some threshold, protecting it, and then preventing them from falling below that threshold. But in rural spaces, and the case is also true for urban, but in rural spaces where people often own some means of production, it also, there's a kind of a large and growing body of evidence that FAO has been involved in and others that highlight that it also can serve these kind of economic impacts. So what we can call promotive impacts, so enhancing income and productive capacities, and then transformative impacts, so addressing issues of economic inclusion and equality. And so there's a lot of evidence that these kind of multiple impacts are important, not just the sort of immediate consumption, but also this productive impact to facilitate basically inclusion in markets, enable households to overcome the liquidity constraints, the consumption risks that may prevent them from participating in economic activities. And also by providing cash to people whose expenditure tends to be fairly low and whose expenditure tends to be bought on local consumables, supporting these poor households has these impacts in rural economies that ripple through the rural economies to affect non-beneficiaries through income multipliers. So, in the context of COVID-19, obviously, this is an important kind of insight that these programs can help to, yes, mitigate short-term loss, but can also support future recovery. But it depends very much on who's being targeted, how much they're being targeted, how long they're being targeted, because you don't get these productive impacts often through a one-off transfer. You need sort of sustained support that allows you to start, being able to take more risks. And you also need to target a broader swath of the rural population, not simply those who are the most destitute, but also those who maybe have some productive potential. They own some land, they have some resources. And many times programs do not cover these, but not in all cases. So as Jan mentioned, and obviously the social protection systems in Africa have been growing. So we've witnessed, substantial growth in the last 2 decades, responding to insights from Latin America and elsewhere on the effectiveness of these programs. And so by 2015, yeah, basically every country has had at least one social safety net program. But prior to the pandemic, the programs were still characterized by very low levels of coverage. So estimates in 2016 suggested that 71% of the poorest households got no social protection support. Only 16% of children in Africa were covered by some kind of program, but with large heterogeneity, right? So Ethiopia has a very expansive program. South Africa has a very expansive program, but Nigeria doesn't, right? Although they're trying to change that, I think. So a lot of heterogeneity. So the crisis comes, and we have a system that is already, in many cases, pretty underdeveloped, right? So in some sense, you know, on the right here, this figure shows the social protection response. The x-axis is number of countries, or let's say number of programs, sorry. And we see, a very quick scaling up, particularly of what we call social assistance programs, which makes sense because, you know, many people are informal. And so that's an effective way to support them. So very rapid uptake and across multiple dimensions of it. But despite that, you know, the duration of these programs were generally short. So the majority were less than 3 months long. Only 14% were planned to be for over a year. So that may have mitigated kind of initial welfare impacts for a short period of time, but unlikely to stimulate the kind of productive impacts that you would like to see in terms of recovering from the crisis, right? And to the extent that they're targeting the very poor, they did not catch those who were very much on that poverty line, who fell into poverty as a result of the crisis, which is a problem because once a household falls into poverty, it's much more expensive to support them to exit that than it is to prevent them from falling in. So kind of pointing to some challenges around the targeting and speaking to our questions around targeting. So, you know, what we're anticipating are kind of substantial and long-lasting adverse impacts on livelihoods of agri-food systems. Now, of course, this is being compounded by the current crisis, right? So we get out of COVID and then we go to, you know, have this major global food and fertilizer crisis. But anyways, high levels of vulnerability, probably leading to long adverse impacts. Extensive evidence confirming that rural livelihoods have been upended in very similar ways to urban places. A lot of negative coping strategies, liquidating of assets, increasing food insecurity. And then, you know, as has been shown, there is some emerging evidence that you know, social protection did offset some of these, but was not kind of widespread enough to really be meaningful. So what can we do? Okay, so flexibility, and this is the point that we keep coming to, right? We need social assistance programs that are flexible and relatively low cost to reach this myriad of informal people that depend on food systems. We can't use kind of your traditional formal systems to reach them. We need to reconceptualize how we think about social protection, not just as responding to shocks or mitigating shocks, but supporting recovery and supporting economic opportunities. Essentially, if we want people to participate in markets, they need to have a floor. If they have no, you know, they need to have a consumption floor. It's not a stand-in for capitalism. It's kind of a necessity for a capitalist system to work, or any sort of system for that matter. So what that means is we need to be more predictable. We need to be more targeted, better integration within broader development frameworks. So don't treat social protection as something that's managed by those people in the Ministry of Community Development and Social Services. It needs to be integrated with Ministry of Agriculture, Ministry of Labor, et cetera. We need to understand how these can complement. So that means more coherence across ministries. We need to expand coverage and change our targeting criteria to include more of the potentially productive to leverage this economic benefit of these programs. And that, you know, requires, and this has been pointed to, a more flexible system that allows, based on sort of, let's say, digital registries and things like that, that allow us to very quickly scale up and scale out these programs in response to anticipated crises or changes in other kind of factors. Of course, we need to be able to fund that, and that means rethinking where some current kind of economic resources are being allocated to perhaps, so I'm thinking, for example, of huge money spent on input subsidies. Some of that may be better spent in kind of a cash transfer support. But we need to be kind of creative about that as well, and perhaps thinking about green financing, for example, climate financing as an adaptation response to climate change. So tapping into alternative resources. So I will leave it at that, and thank you very much.
Thank you very much, Nicholas. Really, yeah, very interesting presentation. I learned a lot, and I'm now looking forward to the comments from Yetunde.
Thank you for the opportunity to speak about the publication. My first comment would be to agree with the authors about expanding the coverage of the social protection plan, and also to incorporate it into the development plan for each country. I would also like to add a comment that this has shown that it's necessary to evaluate the implementation of pre-existing policies that should have actually assisted in providing resilience during the pandemic. And judging by the deficiencies that have been highlighted in this paper, I think it would be safe to say that sub-Saharan Africa is not well prepared for this shock. And I would like to also ask about the food reserve policy, how it has the implementation of this food reserve policies, how have they actually been contributing before the COVID era, during the COVID, and in the post-COVID era? And is it safe to say that they were poorly implemented, given that the scope, scale, and reach of the social protection programs were not enough to provide resilience for the countries in sub-Saharan Africa? And then what should be the ideal food reserve that each country should have that would help to build resilience for such disruptions in trade and resilience itself? And given that the most recent disruption that we all know is in relation to the war in Ukraine, which impacts the energy supply, even in wheat and fertilizer and grain. And what level of implementation of the regional free trade zone can we incorporate to mitigate against similar future disruptions? And would it be a good way forward for bodies like ATOR to also draw attention to how important food reserve policies can be in building resilience against such future disruptions in food systems? Thank you for the opportunity, and if there are any comments that can be provided.
Okay, thank you, Yetunde. So food reserve policies, so my experience with food reserve policies have come primarily from Zambia. And the Food Reserve Agency, during my time there, for a series of 4 years, 5 years in a row, the small-scale producers produced a surplus of 1 million tons of maize every year. The Food Reserve Agency responded to that by worrying that the price would go down and came in to buy that maize, but they didn't have the capacity to manage it. They ended up losing vast quantities of maize. It was rotting. They ended up bottlenecking the maize in so that only the large-scale mills were able to access it, and all the what they call chigayos, the small-scale mills, were not able to. And so during these kind of bumper harvest years, food prices went up substantially, maize prices, mealie meal prices. And the government lost a tune of $500 million or so in this. So probably more than that. So in that sort of model, so we have this challenge, right? I think that governments need to have systems in place to protect the consumption of people. And particularly now, as we're seeing with the global food price spikes, some kind of reserve is necessary. But one that involves the government purchasing large quantities of maize directly from farmers, storing it and distributing it, is ripe for corruption and tends to be, ineffective, at least in my experience. So I think that there are multiple ways that we can think about this, and that could involve very small physical storage, some paper storage. So for example, options to buy on exchanges, for example, the South African exchange, where you can sort of have an option to secure a future delivery on an agreed price, and then a robust safety net program that protects people's ability to consume through a responsive cash transfer program. So as food prices go up, that system expands out and up in response to those prices. So I agree that some physical stock is necessary, particularly now. I might not have said that like 5 years ago, but it can get out of hand, and it can lead to major budget challenges. It can lead to all sorts of elite capture. Remember, in small scale farming areas, most producers are actually net buyers, right? So the producer price support only goes to the better off. And so it's really the consumption side that we need to mostly worry about. So a more flexible kind of multi-dimensional program that, like, you get to this kind of regional question, and I think that's really important because a lot of these borders are somewhat artificial, right? And so the production areas and the consumption areas may be across from each other from this artificial border, right? And so a regional trade, but with perhaps some government support is the way that I would think about it, but with the safety net program. Thanks. I hope that helped.
Wonderful. Thank you very much. Now this leaves us about 10 minutes for any other questions from around the table or from around the room. And I don't see any hands up at the moment, but there were a few questions online earlier, some of which have already been answered. And Getaw, I'd like to come back to one question that was asked by Pamela, because I think it's a really important one, and it's one that comes up in many meetings and events that we have, and that's about data and data availability. And Pamela's comment was that estimating the welfare and resilience impact of interventions is a good research area, but is data available to carry out such an analysis? And what can AKADEMIYA2063 do to reduce data problems in Africa? Because this is a huge challenge we have in research.
Thank you. Thank you. Shall I respond? Yes.
Yes,
I think,
please go ahead, Getaw.
Yeah. Generally, I think from academia perspective, I think academia, we recognize that the problem of data. I think data is very, very big problem for African research and also analysis and all these things. I think, but we have to think about the data problem case by case. For example, at macro level, mostly on related to trade and all these things, we are dealing with collecting some data from different sources and harmonizing them, and just using some modeling approach. Some of them we predict them, and then I think we recently have started the trade outlook. So I think that gives a macro level issues, but at micro level still we are struggling with to get, data which are harmonized, which are up to date, and also comprehensive enough to do some impact analysis or maybe strategic analysis and all these things at macro level, especially when it comes to on welfare issues and when it comes to on social protections and all these things. So one way which we think as a best way is to have more to have certain type of comprehensive data, micro level data collection at country levels. I think we have started in Senegal, and then we call it smart cluster based database system, which means that we bring all the actors in the country who are involving on research and strategic analysis and all these things, and then those guys jointly collect data on different issues, like maybe production issues, consumption issues, and also maybe input supplies and market price and market issues and all these things. And that requires them actually a lot of investment. And I think those are the way forward, because at country levels, you can't get, I mean, let me tell you the experience in Ethiopia, because I thought Ethiopia is one of the most surveyed countries in Africa, but still you cannot get a very comprehensive data set which is publicly available to do some welfare analysis or those things. So I think one way is a coordination mechanism. The data might be here and there, then there should be a sort of mechanism. I think those are the issues, and we don't have, especially for micro level data, and currently we have very little, like the LSMS, the World Bank, this Living Standard Measurement Survey data for some countries, and you might get it publicly available. And I think those are the things that are fragmented data here and there. So probably in the long run, we have to focus on how to generate a very comprehensive data and how to make it available for research and also for analysis, all those things. But currently what we can do until then is we have to depend on projects and programs. I mean, so that we can collect some primary data from specific countries and then do some welfare analysis. Those are the options we have.
Thank you, Getaw. I now see a few hands up. Nicholas, I think you were first, and then I'll hand over to Pamela.
Okay, yeah, thanks. I just wanted to jump in on this because, I mean, yeah, data is an issue, but kind of more broadly, you know, this concept of resilience, right? How do we define it, and then how do we operationalize it empirically? And resilience to what? And so this is obviously an ongoing debate in the literature. How do we define this latent concept, and what sort of data do we need? I mean, resilience is often thought about as the ability to sort of bounce back without kind of structural changes. And so in that sense, what sort of data do you need? Well, you need panel data, and you need very detailed kind of multi-module panel data. So like was mentioned, I mean, so these exist with the LSMS ISA surveys to a certain extent, but that's a fairly low number of countries, and that's where all the kind of micro research on these topics is focusing at this point. And so there's this just kind of vast black box out there with all these other countries that we just don't know very much about because we don't have the data. The other point is that we really need to concentrate on making sure that our data are georeferenced at some meaningfully kind of granular level. So, you know, exposure to climate shocks is a major question. You know, resilience to that exposure is a major empirical question. If we're not able to identify where households live, at least within some kind of fairly granular area, we cannot associate exposure to welfare outcomes and analyze those relationships effectively. And you know, there's a lot of data where it's only at a district level. That's your best geographic reference point. That's just not sufficient for this kind of work. So that's another area that I think we need to, you know, make sure that we harmonize across all of our new data collection work. Over.
Thank you for that. Pamela, you were next, and then Jan, please come in directly afterwards.
Okay, thank you, Katrin. My question is directed to Dr. Sitko, and it's on social protection programs, flexibility, and so forth. From the presentation, of course, it was looking at the social protection programs which came for COVID-19. But if we look at the African economies, with 70% of the people living in the rural areas, depending on rain-fed agriculture, we can see that there is really a need, because we have a lot of households which are having maybe zero yields from climate change, droughts, and so forth, but have been the governments responding to these challenges or needs? Because from the presentation, we have seen that maybe they have responded through one-time intervention or interventions on 3 months, but we have these households through climate change who have their livelihoods being eroded. And I'm not sure if the governments are responding very well to this crisis, because as far as we have these populations, these smallholder farmers, depending on rain-fed agriculture, and if they are not covered by these social protection programs, then we're not going to end the challenge of food insecurity and hunger. So that is what I wanted maybe to know, to get more insight on this issue, how it can be tackled in Africa. Thank you.
Yeah, thanks, Pamela. I mean, you know, we just did a review of national adaptation plans in Africa, and only 3 countries mentioned social protection as part of their adaptation plans. That's a shockingly low number, given the magnitude of the problem. And I think, you know, we're dealing with, and this is a global problem, but again, reconceptualizing what social protection is. It's not just consumption support. It is necessary, particularly in small scale agriculture, to enable more kind of productive investments, to enable more risk taking. And so I think it's really about working with ministries of finances, working with major line ministries to understand the role that social protection can play in helping to achieve national growth and development objectives, not just kind of protecting a food security floor. And so this is, you know, we need to build up a critical mass of people that can articulate that vision. Policy change is never easy. Over.
Thank you. Thank you for the response.
Thank you. Over to you, Jan.
Yes, thank you. I just wanted to add a little on you know, the question of on data, and what Getaw and Nick mainly talked about was you know, describing how it's already hard to come by good data to essentially assess the effects of or the performance of social safety nets. And I just like to point out how this how this illustrates then the difficulty with data for the actual targeting of these social safety nets, which is an exercise with several orders of magnitude larger than collecting data on a representative sample of a population, right? And this is something we certainly cannot cover here, but I'd like to encourage people to think about essentially innovative ways of doing that, because I think we can all agree that in many African countries it is currently not feasible to have up-to-date granular data on every single person, every single household, and that there could be other ways of targeting, thinking of more geographical approaches combined with administrative data from other parts of the government, combined with remotely sensed information, etc. I don't think anybody so far has really struck sort of the right struck the right balance for these things, or at least I'm not aware of a program that would. But that I think is the frontier where much new research and much improvement can and should be done. Thank you.
Thank you, Jan. Now questions and comments are coming in. We're slowly running out of time, so I'm giving Malawi the floor, and then Patrice, I saw your question, but it's cut off in the chat, so I'll be calling on you to unmute yourself and ask the question following Malawi's comment. Malawi, the floor is yours.
Thank you, Dr. Sitko, for your presentation. In your presentation, you mentioned something interesting regarding green financing to help with the funding for restriction funding for social protection programs. And I found that interesting because I saw that in chapter 7, where after governments had planned their social protection forms and adapted them, you'd find the development partners coming in and being the ones who were responsible for implementation of those plans. And usually those plans were not the ones that government had adapted to. So I would like to say I agree with the private and public partnerships between government and the private entities, because after all, our governments are the ones that have the databases that we need to reach the targets for the most vulnerable households. Meanwhile, our government lacks the capital to help with the implementation of those programs, and you'll see that the programs are actually not reaching the people that need them the most.
Nicholas, do you want to come in to comment on that?
Yeah, I mean, I think, well, my point, I mean, I think your point is well taken. Obviously, kind of building up institutional capacity to manage these programs is critical. My point with the green financing was to think kind of more creatively about ways in which we can finance social protection programs. And so what I have in mind here is that, particularly in rural areas, you know, the mitigation of climate change through the sequestration of carbon and reduction of emissions is a global public good. It's solving a global problem for which these farmers are not responsible. And you cannot expect them to adopt practices that do this, which can have kind of short-term, they tend to have short-term adverse effects on production, because it takes time to learn them. It takes time to build up the biological processes that make these more climate smart programs, systems work effectively. That we can think about using global climate financing to incentivize this through, you know, conditional sort of cash transfers, conditional on climate adaptive investments, or public works programs that build up climate adaptive infrastructure. So that we're not just thinking about, you know, funding of social protection from you know, scarce treasury resources, but can also kind of tap into these other sources to, you know, achieve somewhat similar objectives, which are to support, you know, these producers to maintain their consumption and to develop their economic capacities over time. So that's kind of where I was going with that. But obviously, you know, we don't want the kind of proliferation of 9 million different social protection programs funded and, you know, managed and targeted in different ways. I mean, the government needs to be in charge, and that's why green climate financing is important, because that comes through governments. So, you know, so that the forest ministries, the environment ministries, the agriculture ministries start thinking of this as a mechanism. That was my point. Over.
Thank you. That's really interesting approach and thinking. Now, the last question and the last person I'm going to give the floor to is Patrice. Patrice, the floor is yours. If you can please keep it relatively short, that would be great.
Yes, I will be very short. Thank you very much for the presentation, very interesting. So I have, my first question is directed to Dr. Tadesse, and it's more related on when we're assessing the impact of different policies. I just wanted to find out if you did account for the duration of a measure. Like, let's say for some countries, they were putting some measures for 3 months, for 2 weeks, and for some other countries for let's say 3 months. So I believe when we see the impact, there might be some huge differences. And also in African countries, we saw an issue with compliance with those measures. So I wanted to find out if you did account for that aspect, because they can be measures that have been decided, but because people did not actually comply, we can see we may think that actually that measure worked or didn't work perfectly. So and then the second question is highly related to the social protection. I know we have mentioned that there was a lot of uncertainties, But my question is still on how do we prepare for that, for something like COVID? And I know we have mentioned cash transfer, but we have seen that even people in rich community in Africa were struggling to find, at some points during the COVID, they were not able to access food. So to what extent can we even advocate for cash transfer, like, for example, based on the different answers we have given?
Thank you, Patrice. Can you specify the second question is directed to which speaker?
It's both Nicholas and John, since they presented on the social protection. Yeah.
Let's start with the first question, and then Jan and Nicholas, you can get ready to have very quick responses to the second before we wrap up. Thank you.
Okay. Thank you for the question. I think, admittedly, I can admit that this is not really sort of a strict way of impact evaluation. This is just like a qualitative way of looking at how the countries have implemented and what were the best practices and lessons that we can generate out of the implementation of those policy responses. So because of that, we didn't control what you have mentioned. For example, the duration of the implementation. And actually, some institutions, they have tracked, I mean, the number of months, the number of days they have been supporting the families and all those things. So, but for us, I think we didn't count that one, but just looking at what are the practices in terms of targeting, on-time implementation, and also delivering to the services or the supports, or the methodology of delivering the supports and all those things. And those are some of the indicators to look at the quantitative implication and how we can learn from, because I think emergency responses are usually very hectic because the risk has already happened and the government has to mobilize a lot of resources and a lot of institutions. So I think those are what are the best things to learn from our experience for COVID-19. That was the objective. Otherwise, we didn't, I think the short answer is we didn't control those things, compliance and durations and all those things.
Thank you, Getaw, for that answer. Over to Jan and then Nicholas. Thank you.
All right. Thanks, Patrice, for the question. Very briefly. Certainly, a cash transfer won't help somebody who can't actually buy food, who can't access food physically from the market. But I think it is safe to say that currently there is an over-reliance on, on, let's say, in-kind food support, etc. in many countries in Africa. Many people who could actually who could currently access food in the market are instead receiving, quite inefficient aid in kind. So there's certainly scope to shift more towards cash from where we are now. For the rest of it, I agree that there certainly are places where markets are not functioning, and there, of course, what needs to happen, we need to work on those markets and put in place policies that will strengthen them, that will make them less thin than they currently are, and therefore less vulnerable to to shocks like COVID-19 and others. And there is a lot of work that does go in that direction. Certainly more needs to be done. So cash for absolutely everything, no, but for more situations than we are currently using it for, I would say. I'm not sure if Nick, you want to add something.
Yeah, I mean, just the last kind of following on, like, how do we prepare for all this uncertainty as well? And I think it's really investing in the infrastructure. So really investing in good registries, getting knowing who these people are, where they are, who what their characteristics are, so that when a shock happens, systems can be scaled up, can be scaled out. If it's a food shock, then we can respond the system accordingly. But without that investment in the infrastructure of the system, we'll never be able to respond. And so the more we develop these systems, the better we are to respond to their various manifestations. But I agree. I mean, rarely is so. There are places where it is difficult, extremely difficult to acquire food. But oftentimes cash can solve a lot of problems. It just needs to be responsive to changes in prices. Over.
Super, thank you very much. This brings us to the end of the seminar, and I'd like to thank all of our speakers for great interventions, really interesting presentations today, and also to our three discussants. I think it was a really good session, very good discussion, interesting questions and comments. So yeah, thank you very much. And thank you to all the participants for being here today, for taking the time and for getting involved in the conversation. It's really been a pleasure. Our next seminar is taking place in 2 weeks' time, where we're diving into topics around machine learning, resilience building, and vulnerability. And we look forward to reconvening then. Thank you very much and goodbye.